think the adapters of interactive technology are innovators in terms of looking for new ways to address patient experience.
What Skylight allows a hospital to do is focus the clinical resource on the people, on the patients that require the attention at any particular time.
I think Skylight has been an excellent partner for us. They are extremely responsive to us. They'll sit there and listen to us, brainstorm and think of all kinds of things, and then they'll help us figure out how to implement those. Not only do they help us figure out how to implement them, but they help us figure out how to streamline our workflow.
The workflow in a hospital where there's no Skylight is much more labor intensive. The Skylight system and the application bring a supportive reminder to the hospital's workflow, to the nurse's workflow. It doesn't change the workflow, it only supports them by automating a number of tasks that the nurses have to take care of themselves, such as delivering patient education and, better yet, documenting patient education.
And so our initiatives with Skylight is looking at improving that discharge or transition plan to home, to a subacute area, how to provide education to patients, families, and the community on wellness and life choices before they ever get sick. In addition, we are utilizing them in several initiatives in improving the process and outcomes within the hospital, preventing errors from ever happening. How do we prevent infections from occurring in the hospital? As we all know, that is one of the drivers of increased cost in healthcare.
What's important to the patient and family has to be important to us for us to be successful. Skylight uses that data that's been harvested and tested, and they give us that data back, and that's how we're proactive in our approach.
Interactive technology can drive right at specific HCAHPS questions. I mean, HCAHPS is sort of a tactical response to addressing the measurement of patient experience. But when we begin to look at the key elements of HCAHPS in particular, interactive technology can be set up to truly address those issues.
We find that very quickly as our nurses support it and our nurses endorse it, patients are watching. We have a new fall video, and we've seen our falls really drop dramatically in the last 2 months. So we're very satisfied with how we're seeing some initiatives related to patient safety being affected positively by using Skylight.
The benefit of Skylight is that it supports the workflow in that it can document the patient education automatically, which takes one of the tasks off of the nurse's shoulders and actually makes sure it's compliant with this automated documentation.
We've actually hardwired some of the Skylight education information into our electronic medical record. So a patient will watch a videotape, they'll answer some questions, and it actually gets automatically documented into our EMR. So that has removed one step in the process for the nurse, that they don't have to do that anymore.
We have a great account manager who is at our beck and call. He helps us with any of the tools that we want to add onto Skylight. He brings me ideas about best practices that are being implemented around the country. So I am a great advocate of Skylight because of what it can do, but also because of the support that they provide us.